Pressing record. Hello and welcome. So hi everyone, this is Jodie Ross. She's a health and personal development coach, and Jodie also specialises in the field of pregnancy and women's care. And so we're going to talk to Jodie today about how to have a conscious and empowered pregnancy and birth. So Jodie's got some awesome tips about how to prepare for an empowered pregnancy and birth, and you're going to explain some of the factors about the nervous system and why that's so important when we're going into birth, and how state of mind is super important as well. So Jodie's also going to share a bit about her story at the start about why she got into this field and why she's so passionate about helping mums. So I'll hand over to you now, Jodie.
Hi, Em. Thank you. Hello, everybody. So do you want me to start by sharing my story first?
Yes, that would be awesome.
Yeah, I'll just let you know a little bit about me. Em's already given me a great introduction. But I've been working in this field for the last 4 years now, and what led me to it really was my story. So I've got 2 children. I'm a mum myself, and with my my daughter's birth, she's 11 now. I had a dreamy pregnancy. I fell pregnant really easy, dreamy pregnancy, and then I was 10 days overdue, which resulted in induction, and then ended up with the emergency cesarean. She was fine, I was fine, we were both safe, but there was, I was very distressed, and so was she, which led to a whole host of problems post-birth. She's a little ray of sunshine now, so, and from 6 months she was happy, and I was happy, everything ended up fine. But I went through a whole healing journey myself and looked for lots of tools and things to help me and my bubby. And I guess I kind of got to a state where it's like, man, everyone needs to know this stuff, because I then could look at it and go, oh my goodness, if I knew this stuff back then, I could then look at it and pinpoint and go, well, that's why that happened, that's why that happened, that's why that happened. And while I don't regret it happening, because it all happens for a reason and everything leads you where you need to go, I wouldn't be doing this stuff for, helping other women with it had I not gone through it myself. Yeah. I could look at it and go, if people knew this stuff, it wouldn't have to get to that stage. And so, and then the other element is now I know really to help women as well, if they have experienced birth trauma, how to recover from that, to have a happier reflection on birth for starters, which also helps mummy, helps bubby, and if they want to, have more kids so they don't have to go through that again, or do as much as we can so they don't have to experience that again.
Awesome.
So,
and
that's what led me here.
Yeah, amazing. And we're going to talk about that in another interview as well, about what birth trauma kind of looks like and how we can try and heal that if that's something that mums have experienced. But in this interview, we're going to sort of talk about that, how to create that consciousness and that empowerment around your pregnancy and birth, so that doesn't happen. Can I just ask you a question? Possible. Yes, absolutely. And can I ask you a question, when with that experience, because you were 10 days overdue, were you induced just because you were 10 days overdue, or was there was no fetal distress or anything like that? There was no actual reason except the time frame?
Correct. And now, knowing what I know, I've got so much more knowledge and know that that's not necessarily a bad thing. Back then, though, I had no idea. I handed all my power over to the medical team. This is what I was told to do, and so there was no negotiating, I guess, from my perspective. Was I at ease with that or not? And that's what led to my experience, is because I handed over my power to someone else. And you do need your medical team, we need them there. But there was zero input coming from me there, which led to the host of chemical processes that happened.
Yeah, absolutely. And it's one of the things. One of the things we talk about a lot in the program is having that health professional and that you trust. Absolutely, that continuity of care. The research shows that a midwife is the best person to provide that in our current healthcare system. But as we were talking before, some people want an OB, some people want a doula, and that's okay as long as you have the trust with that person, and that then does create that sort of empowered experience more so. That's what we're more
Yeah.
likely to have an empowered experience. And one of the other things, interestingly, I talk about is what is term and what is your due date, like, and so what we know now is that, you can go to, 42 plus 10, well, they call it 41 plus 10, which is 42 weeks and 3 days. That could be your due date. There's actually no evidence around 40 weeks being the due date, and going from, I have recently had a friend who knew what day she conceived, because there was only one time that they possibly conceived, and she told the OB that, and the OB said, well, that's not how we do it. And she goes, but that actually makes my day. And they wanted to induce her because she was an older mum, and they told her she had to be induced. And I actually said to her, you don't have to be induced. It's like, because she was over 40, that increased risk of stillbirth, but they didn't consider her case, or the fact that she knew when her conception date was, did not consider it, and the fact that it was her second baby, she was really healthy, and all of these reasons that she did not need to be induced. And so she said, I don't want to be induced. And they said, oh, okay. Oh, it's your body, which was good outcome. And then she went into spontaneous labor and she had a natural birth, and it was all fabulous. But
that's amazing.
Do you know what? Like, if we hadn't have had that conversation, and that was one of the key things that led me to do this program, was I was like, we need mums to be able to know this, like they need to have access to this information so they can make an empowered choice, an informed choice. So anyway, I didn't want to steal your thunder, but it's such a common story.
No, I absolutely 100% agree. And it all comes back to, the more you know, the more choices you can make. And the biggest thing, and we'll talk about nervous system in a minute, but the biggest thing that I can recommend to anybody is to get yourself into a state of trust. Trust your body, trust your team, be involved with making the decisions, and trust your baby. A baby's going to be, if the body is clever enough to get pregnant and make a baby, the body is clever enough to deliver it. The baby's going to be born.
Yeah.
And if you can get yourself into a state of just tuning into your body and trusting your body and trusting your team, then your hormones are going to be able to do their job properly, and you're going to have much more chance of being able to birth your baby how you want to birth your baby.
Yeah, that's such good advice. And a perfect segue into, that sort of what your thoughts around that conscious and empowered pregnancy and birth, and then definitely those sort of preparation tips.
Yeah, cool. So when we talk about empowered birth, it's getting you into a state where you feel like you've got some control over the situation. It's still happening, but gone are the days where we get pregnant and we have to just do what the doctor says. The doctors are the expert. Yes, we want the midwives especially there, and if you have an obstetrician, you want your obstetrician there if that's who you have faith in. But you can be involved in the decision making as well. It's really, really important. Like that example you just said, Em. So that's super important. And then what we want to do, and that sort of leads you to your first bit of, I guess, having a little bit of power and conscious pregnancy, being involved in your decision making, really. And then the next part is to do all the things that you need to do, because it's never just a one-fit solution, which is why you're doing this course, but do all the things that you need to do to get your body and your mind, your psyche, in the right state. So it's really important to spend time to process any fears or concerns that you've got going on. There's a lot of hype in the media. We see it in, from when we're little, we see it on TV shows that birth is this excruciating experience and you have to be in pain. And there's no doubt that it does put the stress on the body to deliver the baby, but it can be a really beautiful experience. And part of that is, if you've got things that are going on for you that are making you feel scared or out of control or not knowing what to do, seek the support to work out how to change that and get yourself into the most relaxing and trusting state, because a relaxed nervous system sends the message to your body that it's safe for me to birth. Once a woman gets into too much fear and distress, then the natural pregnancy hormones and the hormones that are required to facilitate labour, they have a much harder job coming in and doing their job. And that's when we see, all the things that can happen with birth intervention, you know. And I've seen it time and time again, and you know, with clients and people that I've worked with, the women who do the work during pregnancy, with whoever their team is, you know, nutritionally with you, with, you know, what I do with, you know, there's a whole host of things that we can do, which we'll talk about. Those who get themselves into a state where I'm feeling good, I trust my body, I trust my baby, I trust my team, I trust the process of time, they're the ones that can end up having a much nicer experience.
Yeah, it's so,
there's even such a thing as orgasmic birth.
yeah.
You know, I don't personally know anyone who's experienced that, but even, you know, there's videos on it. That's possible. You know,
Yeah.
It doesn't have to be what we're conditioned to think it needs to be.
Absolutely. And you know what? That when the studies that they've done lately, that in the Australian society, fear of birth is still at an all-time high. Like interventions at an all-time high, birth trauma experiences, you know, and fear is absolutely so. And I'm going to hand back over to you to talk about those preparation tips, because we talked about a few of them before. There's quite a few, you know, the hypnobirthers and the calm birth courses, and working with someone like yourself, you know, these are all about that preparation of the nervous system and the psyche, as you're talking about, to dispel that fear, so that you go in a state of, you know, of trust, like you call it. So tell us all your best tips.
Cool. I just want to just talk one thing about that fear is sometimes I don't think it's the medical system's fault either. Like, they are under a lot of pressure in the hospitals these days to follow this protocol and that protocol and this paperwork. And, you know, so it's their conditioning as well, and the way that they have got to literally check all the boxes.
Oh, and they're the ones liable
if something, as well.
They're the ones liable if something
goes wrong. That's exactly right.
And it's not their fault.
Yeah, so
it's system focused.
It's not their fault at all.
It's risk focused and system focused, and it's not mother or baby focused. It's a bit more baby focused and mother focused, but it's not their fault. That's the system and how it is. And so that the point of this, you know, the program is not to point fingers or anything, but just to prepare you for the fact that that's how it is at the moment. And there's definitely we're working from within to try and change some of those policies so that we can have better outcomes, like, you know, having that availability of midwifery continuity of care, and also more birth choices of places to birth, like home births and birth centres and those kind of things. But at the moment, this is how it is. So, you know, we need to have, you know, access to as much support as we can get.
Yeah, and I think people, if women have an awareness of that, and they can go, radio, these people are just doing their job, they can still use that to their advantage and have a great experience in hospital as well, because the main thing those doctors and nurses want is to make sure that the baby is safe and mum's safe. But you can still be very, very involved with what happens. So,
absolutely.
So, okay, so what can we do about it? How can we make it happen? So my preparation tips, like what we spoke about before, it's never just one thing. I guess it's a holistic approach and an integrative approach. So I look at it and I think anything that you can do or three things really. The first one is nourish your nervous system with activities that create healthy balance. So obviously the first one is nutritious food and supplements, which is where you come in, because that's your absolute specialty. Anything that affects your body chemistry affects what's going on for mum, baby, and emotions as well. Obviously, you know, exercise, breath work is a huge one. Even just simple things like, if you are feeling stressed, just simple things like extending the length of your exhale, because your exhale is actually what activates the rest part of your nervous system, or the calm part of your nervous system. And this is a trick through pregnancy, but also through labour. If you are feeling sort of that stress, you literally do just a long, slow breath out. That is enough to switch from here to here in terms of calm. You know, the techniques that I work mostly with are tapping, EFT, and matrix re-imprinting. So that's really where we get into helping you with your subconscious, because the subconscious is kind of like subliminal messages and beliefs that are coming from the background. So there's lots we can do there. Meditation, hypnobirthing, I know that that's one of your modules too, Em. You know, that's fantastic, because that really helps you actually, when you're going through the labour process, gives you some strategies actually what to do. You know, a lot of people these days are seeing a doula, midwife, and choosing, I guess, whoever you choose, just make sure you trust them.
Absolutely.
Whether it's an obstetrician or you're going through the public system, or it's a private midwife or doula or your best friend, your husband, whoever, just make sure you surround yourself with the people that make you feel safe, and that you feel like, yeah, I'm in a sense of trust right now that this is okay.
The research certainly supports that it's the relationship you have with your primary
It's
health care
huge.
provider that is the biggest factor for how you're going to have that experience.
Yeah. I look at my experience with my first bubby, what led me to this work and where it all went pear-shaped for me was in that period where I was overdue and I lost all trust. I completely lost trust in my body, my team, everything. And that's so that's the biggest thing that I learned. If you can go into trust what's going on, then your body's clever enough to do the work anyway. Yeah. The second thing that is super, super important is we've got to nourish the body, but we've also got to nourish the mind with empowering thoughts and feelings. So if you're finding this challenging, seek the support. You know, that can be, come and see someone like me with EFT, tapping, matrix imprinting. If psychology or counselling is your way, then go and see that person. If it's talking to you, a healthcare professional about it, something to put your mind at ease, then do it. But it's really important. The story that you're telling yourself is, I can do this. I'm safe, my baby's safe. And if there's things that are blocking that, then get the help to be able to change your state there. That is huge.
That's massive. It's got to be the most important thing, doesn't it? Yeah. I'm sure that's what's coming through this conversation, because we're both like, yeah.
It's a story that you're telling yourself, and that's conscious and subconscious. So you can be like, I can do this. But if you've got niggling stuff in the background thinking, birth scary, or what if I can't, or I've heard all these number of horrible stories, what if that could happen to me? If that's still there, then that's still playing on your mind somewhere that you're not even really aware of. So that's why it's important to do both. And I guess my last little nugget there is, it goes back to what we've been saying the whole time, is just trust your body, trust your baby, and trust time. Because remember, if your body is clever enough to make a baby, it is clever enough to deliver it. You're not going to be walking around with a 2-year-old baby in your belly. It has to come out. So the female body is designed to give birth. So if you give it the messages to do so, both consciously and subconsciously, and keep yourself in that state, then Bubby's going to be born in hopefully the most empowering way that it can. And then that leads to a beautiful experience post-birth and good connection. And, if a woman wants to breastfeed, that part's a lot easier, and all of that stuff.
And the bonding and all of those things. And so true. And interestingly, my story is with my second baby, I went 10 days late as well. And so I was told that I had to be induced. And I was like, because my subconscious and my conscious mind were like, no way, I've got this. I trust my body.
So good.
Someone asked me the other day, I've got a friend that's about to go into birth, and she goes, what's the best affirmation? I go, the best one for me is, I am woman, hear me roar. I was so, I was like, awesome. I can do this. And when they said, you have to be induced, I was like, no way. And they were like, what? And I was like, but the baby will come out. It's obviously not ready yet. I don't care if your 10 days say that. How do you know when I conceive? Like, you actually don't know. And so, I don't know. I don't know.
That's
I was
so
young.
good.
I was 25. So I was like, I had this crazy self-belief. I was also a bit of a hippie, and I was very, I was very in tune with my body, and I was just like, nah. And they kind of said, well, you'll have to come in every day and get the heart rate monitored. And I'm like, that's fine. I'm not doing anything else. I can do that. Like, you don't scare me with your scare tactics, that was, and
awesome.
I think that was an OB. And because with my first baby, I had private midwives. And so that never came up. I never had that. No one ever tried to scare me into anything. I was completely supported, and I had amazing experiences with my second. I was like, I got this. And universe had just happened that my second baby was delivered by the same midwife, because she was just happened to be on duty.
Oh, wow. That's awesome.
So it was like, she was just finishing her shift, but she stayed to deliver my second baby as well. So it was like, but it's so interesting. Like, if I had had that same reaction to you, or lost trust or lost faith, you know, in myself, then I may have had a different outcome. So it's just so important. And it's just, that's such an example of the two, you know, the ultimate experience is by just crazy. Yeah. So anyway, awesome. They're such amazing tips, and I just really loved that conversation, Jode, and I think that that would really help lots of mums as well. So I'll finish it there, and then if you're going to do all the modules, you're going to see Jodie again when we're going to talk in 4th trimester, when we're going to talk about if you have suffered birth trauma, or if you're a mum going into a 2nd pregnancy and you've had birth trauma before, go ahead and watch it now, because it's going to be, it's going to be so amazing for you. So thanks again, Jode, and we'll see you again next time. And also, when I do my podcast, we're going to do a whole session on this as well. So awesome. Thanks.